The prevalence of lower chronic airway diseases in Europe is rather high. If you look at asthma and COPD as the two most important chronic diseases of the lower airways, they are very prevalent. For instance, asthma in the adults from 15 to 40 years of age, it's up to 10% of the population, which means that, for instance, in Europe there are about 10 million patients with asthma who are below 40 years of age. Well, these chronic airway diseases have an important impact. If you think about asthma, it impacts on the daily life of our patients if it's not controlled. So they have a lot of symptoms. So they have difficulties in breathing, they are coughing, they have difficulties in doing exercise, they wake at night, and which is also important, that they are doing exacerbations, so an increase in symptoms, and they need to go to the doctor. So it has an important impact on the quality of life of these patients. There is definitely a need for better care. We can, for instance, when we think about asthma, help the majority of patients with asthma. More than 90% are very well helped with the treatment we have available. But the problem is that patients do not always take the medication. So if you don't take medication, you will not be cured or helped. So they have to be learned that it's important to take medication, and also it's inhaler therapy, so you have to take it in the right way. The inhaler therapy has to be correct. So as a society we can improve the asthma care by educational programs, by interacting with physicians and helping them how to handle our patients with asthma.